Here we see the liver's remarkable capacity to regenerate on the left, contrasted with clear signs of severe toxic damage on the right.
Your liver is working 24 hours a day, 7 days a week, filtering toxins, making proteins, digesting fat. But when it starts to fail, it whispers before it screams. Today, as a medical lab professional, I'm going to show you 5 silent signs your liver is already struggling and the lab values that confirm it.
Body signals. Medical lab explained.
I work in medical laboratories every day. I read the blood results before your doctor even calls you. These signs I'm about to share are exactly what we see in lab results when the liver is in trouble. Sign number 1, yellow eyes and yellow skin. The medical term is jaundice, and it's one of the most alarming signs your liver is struggling. Your liver normally breaks down old red blood cells and removes a substance called bilirubin from your blood. When the liver is damaged, it can't clear bilirubin fast enough. It builds up and it stains your skin and eyes yellow.
The lab value is 1.2. Normal is less than 1.2.
In our lab, normal bilirubin is below 1.2 milligrams/dl. When we see values above 2.5, that's when jaundice becomes visible to the naked eye. If you notice yellowing, especially in the whites of your eyes, do not wait. Get a liver function test immediately. Sign number 2, dark brown or tea-colored urine. Most people assume dark urine just means dehydration, but there's a difference, and your liver knows it. When bilirubin spills into your urine, the color turns dark brown, almost like cola or strong tea. This is called bilirubinuria. And unlike dehydration, drinking more water will not make this color go away. That's the test. If you drink a full glass of water and your urine is still dark brown, your liver, not your hydration, is the problem. In a urinalysis, we check for bilirubin and urobilinogen. Normal urine should have 0 bilirubin. Any positive result means the liver is not processing it correctly. Sign number 3, dull pain or pressure under your right ribs. Your liver sits in the upper right side of your abdomen. When it's inflamed or enlarged, you feel it. It's not sharp pain, it's more like a heavy, dull pressure, like something is pushing from the inside. Many people ignore this for months. They think it's a muscle ache or gas, but the liver has no pain receptors inside it. You only feel it when it's swollen enough to stretch its outer capsule. By the time you feel it, the liver is already working under significant stress.
ALT normal, 7 to 56 U-liter. The level is 1 in 40, indicating elevation.
Check ALT and AST, liver enzymes. Normal ALT is 756 U/L, normal AST is 1040 U/L. When these spike, the liver cells are releasing enzymes because they are damaged. High enzymes plus right side pain equal sign red flag. Sign number 4, bloated or swollen abdomen, ascites. This one is serious, and it's often mistaken for weight gain. When the liver is severely damaged, it stops making enough albumin, the protein that keeps fluid inside your blood vessels. Without albumin, fluid leaks out of your blood vessels and pools inside your abdomen. This is called ascites. The telltale signs, your belly is swollen, but your arms and legs are thin. When you lie on your side, your belly shifts like water moving.
Serum albumin test result. Danger zone, less than 3.0. Albumin normal, 3.5 to 5.0.
In our lab, we check serum albumin. Normal is 3.55.0 G/dl. When albumin drops below 3.0, fluid retention becomes a serious risk. Combined with elevated bilirubin and liver enzymes, low albumin is one of the clearest lab signs of end-stage liver damage. Sign number 5, easy bruising or unexplained bleeding. This is one most people never connect to the liver, but it's a direct signal. Your liver manufactures clotting factors, proteins that stop you from bleeding when you're injured. When the liver is damaged, it can't produce enough of these clotting proteins, so you bruise from minor bumps. Cuts bleed longer than they should. You might notice bruises on your arms and legs that you can't explain. This is your liver sending you a message. We measure this with PT/IN, our prothrombin time and international normalized ratio. Normal INR is 0.8, 1.2. An elevated INR tells us the liver is not producing enough clotting factors. The higher the number, the greater the bleeding risk and the more stressed the liver is. Now let me bring it all together. Here are the 5 lab tests your doctor should order if you have any of these signs. Bilirubin checks for jaundice. Normal below 1.2 milligrams/dl. Alt-T and AST, liver enzyme damage. Normal Alt-7, 56. Normal AST, 10, 40U/LC. Albumin, protein production. Normal 3.5 to 5.0G/DL. And PT/I, NR, clotting ability. Normal 0.8 to 1.2. Together, this panel gives your doctor a complete picture of your liver health. One important thing, these tests are cheap, and your doctor can order them today. The liver function test panel, called an LFT, is one of the most basic blood tests available. But don't wait for symptoms to get worse. Early detection changes outcomes. If this video helped you, hit the subscribe button. Every week I break down one body signal that could save your life, explain with the same lab knowledge doctors use, and drop a comment below. Which one of these 5 signs surprised you the most? Important, this video is for educational purposes only. It is not medical advice. If you have any of the symptoms I described today, please see your doctor immediately. Do not self-diagnose.